Alright, welcome. So, if you are new to this channel, my name is Agam Dewan. I'm a board certified child, adolescent, and adult psychiatrist. And so, in this video, I want to share with you how I became a psychiatrist, why I became a psychiatrist, and then how that journey led me to becoming a PMHNP mentor. So, let's get into it. So, in high school, I had this problem of red eyes, red bloodshot eyes, and people could not figure out why I was having this problem. All the doctors I saw thought it was allergies, and so I'd be prescribed various allergy medication. I would be seeing allergists and getting allergy testing and all this stuff, and nothing ever seemed to work. So it affected my confidence a lot, especially because in high school, the peer influence is very important, and people always thought I was using drugs or that I was tired all the time, neither of which were true. And so I spent most of my time playing video games, and this led me to being too scared to ask out this girl I liked to prom because I was scared. I was just scared to do it. I hadn't built up that social skill yet. And some other guy asked her out, and she said yes. So I remember being at prom. I went by myself. I remember sitting there and watching this girl I liked dance with the guy who was brave enough to ask her out. And so this really shifted my mindset. I had this realization then where if I wanted things to be different, then I had to change. Like nothing was going to come and save me. Like I needed to make that shift now. So this is on my first day of college, right as I was heading out. And I just knew things had to be different. I wanted to be cool. I wanted to be popular. I wanted to be social. All those things that any young 18, 19-year-old male would want. So I joined a fraternity. And so it was a big step out of my comfort zone. And it's like almost like exposure therapy in a way, because I was used to hanging around either with not a lot of people or online gamers or just more like nerdy people or science type of people. I wasn't used to hanging around with like jocks and loudmouths and or like, I guess, quote unquote masculine or like that type of archetype. And so that really exposed me to a lot of different type of people, and I really started to become comfortable around guys who are not like me. Started to get more comfortable around girls, fraternity parties, social events, sororities, mixers, like this whole culture that I got enmeshed into. But my eye problem still hadn't really gone away. That was still the biggest drawback to my confidence. And the anxiousness, the awkwardness that I felt, like how I felt judged by other people, that they were always looking at me. And then I saw this optometrist who said that my problem wasn't allergies, but it was dry eyes. And it was because I had this anatomical defect in my eyes and that I need to get surgery to fix it. And so once I saw that, I couldn't unsee it. And basically, if you look closely, you can see that there's a small little gap between my eyeball and the eyelid on like these lateral edges. And so when they did the surgery, they basically just like pinched these two together. And so photo on the right's like, I think a day or two after the surgery. But then over the next couple months, my eyes started to improve. And I was like, wow, like this is actually making a difference. And so then I just started becoming more socially confident. I started going out more and really just getting more in my skin, more comfortable than I had ever been, more relaxed, more open. And so from this change, what I'd realized is that I was able to change who I was as a person. I was able, because I changed that the actions that I took and the decisions that I made. And so I was able to make these mental changes in myself. And so I realized that I wanted to help other people make those changes as well. So I applied to med school, then got accepted. But med school was tough. It's a lot of hours, it's a lot of clinic time, and 40, 70 even hours some weeks. And so it's stressful, and I started eating more and just, not paying attention to my health, and I put on weight. And so then I had to learn all about fitness and mindfulness. Mindfulness really helped me with social anxiety, and then fitness, calories, diet, exercise, all that really helped me with of course, how I looked, but also my confidence as well, how I presented myself to the world. And then eventually I graduated from med school, and like those experiences helped me further realize that, hey, I'm leveling myself up, and so I want to help other people level up too, especially in their own mental health and confidence and how they feel about themselves. So that led me to psych residency, and so I was very excited for that. And then COVID hit. So when COVID hit, I went from being social, doing intramural things. This was in Michigan, to now just pretty much just sitting at home by myself. And this inspired me to start posting on social media, because I was watching a lot of YouTube at the time, and I realized that, hey, I'm learning a lot from YouTube. I was learning on skincare and fashion and things, and patients would be asking me the same questions like Zoloft side effects or Lamictal titrations, or like, how to diagnose depression, or like things like that. And I would be explaining the same thing to people. And I realized that, hey, if I just made videos on this topic, then I could reach 1 million people rather than explaining things one by one, just like the other videos that I had watched had done for me. So then I was starting to get into that. But then as residency was nearing its end, I realized I didn't know enough about kids. And so I was working my outpatient year, and I started working a lot with kids and adolescents. And I just realized that, okay, there's a gap in my knowledge that the adult psych residency isn't teaching me about ADHD, about adolescence, about dealing with parents. So then after I graduated residency, I went to child and adolescent psych fellowship. And then when I went to fellowship, I moved to New York for that fellowship. And then, so during that time, I'd gone through fellowships, so I graduated, and then I also created my own private practice. And the private practice is called Level Up Psychiatry, because I started to crystallize my life philosophy that life is a video game. So instead of trying to level up in a video game, I wanted to help people level up in real life. And that means improve it, like just like I had helped improve my own confidence and fitness and mental state, social life, those kind of things. And so I started noticing that, or as I was on social media, I started noticing that PMHNPs were messaging me. And so I'd already gotten some messages on, hey, can you be my preceptor? Can you be my collaborator? But then I started noticing getting more messages on my live streams too, and I was like, okay, like I think there's something here. And so I just started a program, Level Up Academy, helping NPs learn psychiatry. I was very grateful to have mentors in residency who taught me and watched over all the patients that I saw and taught me all those things that a textbook cannot. And so when I created this program, I had the same intention, because I knew that if I didn't have those mentors, and like I wouldn't be the place where I am at now as an attending, confident in my skills and able to see patients independently without feeling overwhelmed and knowing what to do if I don't, like if I have a problem with in the clinical setting, then I know how to handle it, or I know how to find the info to handle it, or find the people to handle it. So yeah, I started that. This was in March 2025. So since then, we have grown exponentially. As of this time that I'm recording this, we're at 239 members. So this was, you see 221 members here. So this was in September 2025 that I took that screenshot. And it's just grown because I think people are finding a lot of value out of the program, and they're really feeling it, like it helps them in their clinic life, getting over imposter syndrome. And we have members now all over the country, which is, I think, is super, super cool. And so we'll definitely have in real life meetups too. So this really reinforced things. So we got awarded by Alex Hormozy and Sam Oven. So these are two world-class entrepreneurs. So they are co-owners of School, which is a platform I host our program and community on. And we were one of the fastest growing since its launch. And so they flew me out to LA and had a whole award ceremony for me and some of the other people with fast growing school communities. And so now this inspired me I've pretty much shifted all my content to focus on provider education. I was used to be patient education, but now it's focused on providers, because what I've realized is that if I see patients now, I can help, let's say 10 patients a day. But if I teach 10 providers a day, then that effect can trickle down, and now it can help way more people, because those providers will help out their patients. So it's a trickle down effect rather than me just going one by one by one. So now my content, my mission is to focus entirely on provider education, psychiatric provider education. And so I've gone all in on NP mentorship. Like, I've had good mentors in the past, I've had bad mentors. So I've learned that mentorship is everything. From when I had to learn fitness stuff, right? Like I had mentors, mindfulness, I learned mentors, like fraternities, right? I had mentors in there, obviously med school, residency, like I couldn't have learned all this info without other people teaching me. And so now it's my turn to pass on the knowledge, because knowledge is worthless and wasted if it's not utilized and it's not shared with other people. So that's my mission now, is to help you level up your psychiatric skills to get over imposter syndrome and to make a difference with your patients. My life philosophy is that life is a video game, so let's try to level up in real life instead of a game, which I still love to this day. But that's what I want to help you accomplish. So if you're here for this, if this is your first time on this channel, so yeah, keep on watching this. Thank you for being here, and I hope you continue to get value out of this. And if you're a provider, you can definitely check out our PMHNP and FNP psych community as well.